good morning. Myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department in RPIIT Technical and Medical Campus, Karnal. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll talk about the neurological condition that is Gullian-Barre syndrome, which is also known as GBS. So first we'll talk about the myelinated neurons or neurons. So typical neuron is consist of a cell body, its dendrite, axon and nerve ending. And in axon there is a covering of myelin sheath, presence of nodes of Ranvier and the sequence cells. So either in axon is myelin sheath present or not present. According to that, neurons are of two types: myelinated neurons and non-myelinated neurons. Myelinated neurons means they have a layer of a myelins which is produced by sequence cells on the axon. And if there is absence of myelin sheath on the axon, those neurons are known as unmyelinated neurons. So first is the definition of the GBS, Gullian-Barre syndrome or Landry's paralysis. So it is a disorder in which the body's immune system attack part of the peripheral nervous system. It is an acute, progressive, autoimmune, inflammatory demyelination of polyneuropathy of the peripheral sensory and motor nerves and nerve roots. Incidence: 1 to 2 cases per 1 lakh people annually. Men are 1.5 times more likely to be affected than women. It is the most common cause of acute non-trauma related paralysis in the world. And the syndrome is named after the French physician Georges Gullian and Jean-Alexandre Barre and Stroll, who described it in 1916. Next are the various classification of the GBS. So first is acute inflammatory demyelinating polyneuropathy, AIDP. It is the most common and acute immune response against sequence cells. Second is Miller-Fisher syndrome, that is MFS. It is a rare variant, manifest as a descending paralysis. Usually affects the eye muscles first and present with the triad of ophthalmomyalgia, ataxia and areflexia. Third is acute motor axonal neuropathy, that is AMAN. It is also known as Chinese paralytic syndrome. It attacks motor nodes of Ranvier and is prevalent in China and Mexico. Next is fourth. Fourth is a acute motor sensory axonal neuropathy, which is known as AMSAN. It is similar to AMN and it affects the sensory with several axonal damage. And the last classification is acute pana-autonomic neuropathy. It is the most rare variant of GBS, sometimes accompanied by encephalopathy. Its frequently occurring symptoms include impaired sweating, lack of tear formation, photophobia, dryness of nasal and oral mucosa, itching and peeling of skin, nausea, dysphagia, and constipation unrelieved by laxatives or alternating with diarrhea. Thank you.